Well, good afternoon, everyone, and welcome back to our Department of Labor and Economic Opportunity webinar series focusing in on workplace mental health. A reminder for you, many of you have joined us before, there's a Q&A box at the top of your screen that you can submit questions to at any time, and we'll get to as many as we can throughout the presentation. We're going to have a slightly different format today, which will be more conversational, so we can try to do some of those questions on the fly. Certainly, I'll be asking some questions because we have a great topic lined up. Keep in mind, if you haven't already, make sure you sign up for emails on our michigan.gov/workplace mental health page. It also includes all of our recordings of the webinars we've had, and it'll have this one when it's time to post that, as well as our mental health report and other links and information to resources. This is the second webinar we've done this month. Our first webinar was at the beginning of the month with a presentation from Dr. Ashley Nixon of Willamette University in Oregon on technostress. We talked about email, surveillance, all those things, all those tools that we use in our work and what they actually do to us if we don't use them correctly, as well as how we communicate with those, and it's interrupting our normal communication patterns and making it more difficult for us to get along at times. Our goal with all of these webinars is to provide working people and employers with information about issues impacting our workplaces, the impacts to our mental health, and options for addressing those issues. And looking at those three pillars that we've talked about, being in the workplace, affecting the workplace, and individual behavioral health supports, we try to make sure that we're hitting on these topics throughout the content of our webinars and this series, and we think we do that pretty well. And as you've seen in our work and on our webinars, you hear us often talk about this concept of trauma. And one of the things causing trauma on all of our lists, and anything you research, will be poverty. Poverty causes trauma for people. And that's not only for the family struggling in poverty, but it's for the adverse childhood experiences that poverty creates for children that can lead to lifelong struggles. So often we talk about individual behavioral health supports, which are important, but we're talking about helping those that have already endured or experienced the trauma or condition that they need help with. And today we're going to talk about focusing on a cause and ways we should be thinking about how we can address that cause. So our expert today is Dr. Luke Shaefer. He's the director of the University of Michigan Poverty Solution Center. He's researched and written extensively on all issues affecting families as it relates to poverty, low wages, including the health impacts and much of what we will discuss today, how policy decisions impact the ability to rise above or fall into poverty. So thanks so much for joining us today, Luke, and I'm looking forward to a great discussion.
Thanks, Sean. I'm really glad to be with you.
Yeah, so first and foremost, I think for myself and everybody, how do you define poverty at the University of Michigan?
Well, I'm going to start out with sort of the abstract idea, which is I think of poverty as not having the resources you need to live a healthy and productive life. So it's about not having enough money to pay for your essentials, like housing, like food, maybe transportation, clothes, whatever you need to sort of meet those basic needs. But I also think it's about not having access to jobs that provide dignity or not having access to quality education. And so when we think about trying to address poverty at the University of Michigan, we're thinking about how can we make systems work better for any family so they can, seek to achieve their dreams, they can live their lives in dignified ways, the ways that they want to. In the federal government, we spend a lot of time defining poverty as a lack of income. And so, scholars like myself debate endlessly, like, how much money is enough, and how much money should do people have, and what should we count? Should something like food assistance be counted as money when we're calculating a poverty line or not? And so one definition of poverty is sort of the static idea that you over the course of a year you have so much income and it lifts you above or you're below this kind of arbitrary line of enough. And so a lot of people, as I know your listeners, viewers, I think have heard about, there's a lot of people that think sort of the official poverty line is way too low. So if I'm talking about a family of 3 surviving on $28,000 a year, it's very difficult to see how somebody could live a healthy and productive life with that amount of money. And so that's what has led us to think about ALICE and try to think about families who might be above the poverty but are really struggling to make ends meet. The only other sort of idea that I want to put on the table with this first question is that you have sort of the level of income, say, over a year that really matters, but also the volatility of that income. So it's not like families in the United States who might be just above the poverty line. Let's say they're at $30,000. It's not like every month you can take that and divide by 12 and know exactly what their income is, because the financial lives, because of instability in the jobs that are available to families at the bottom of the economic ladder, and instability in the family lives, and instability in the environment, all of these things mean that families have sort of really big swings, that's actually more the norm than the exception. And so families are dealing with like having more income for in some months and a lot less. And that's actually really difficult for humans. And I think feeds into some of the instability in housing that we see, and it feeds into some of that stress, because it's not just about like trying to figure out how to manage with not enough money, like figuring out how do I get stuff for cheaper. It's both that and also sort of not knowing what you're going to be working with month in and month out, and that instability that can really feed into a lot of other things.
Yeah, I like that. You made 2 points. I'm going to just sort of like technical points here, right? So I have this discussion often. You're the expert, so you can tell me if I'm way off base. But when I talk to people about the federal poverty line, I always try to remind them that that line, while we're all familiar with it, isn't really based on anything real. It was created decades ago by a really smart person, but they basically took your basic food budget, whether for an individual or others, and multiplied it by 3. I mean, it's not like there's all these other costs or other things that you're dealing with. So you had mentioned also ALICE, which is asset limited income constrained while employed. And that's a number that we use here in Leo as well, which does pull in all that other stuff, childcare, housing, transportation, and really tries to evaluate how much people need just to get to that basic need level of survival. Is it, so I can move on? I didn't say anything too incorrect. Okay.
Oh, yeah, you're crushing it. Well done.
Okay. Can you talk a little bit about how poverty itself affects people, like their health and well-being, especially kids?
So you can imagine just the strain of not having enough. Sometimes that can affect say the amount of food, again, the stability of food. So when we think about something like food insecurity, in most American households experiencing food insecurity, it's not day in and day out, but it spells, say, like at the end of the month, right? When the money from the paycheck has run out, the money from food assistance has run out, and families are really sort of struggling to get to that other side. And we can actually see in data like the response to that, like kids in school who are at the end of their benefit cycle get into more disciplinary challenges, right? They're more likely to get in detention or suspended. They don't do as well on tests. And we can see the impact of both like not having enough food assistance, but that sort of coincides with the end of your paycheck, and also school meals. And we can see the incredible sort of impact of having school meals more accessible to families and what that means. So you've got food insecurity of not always, and for stretches, like enough food or the kinds of food. You've got access to what kinds of food we're talking about, right? So usually if you're low income, you're more likely than not to be in a neighborhood where more people are low income, and so you have less access to sort of healthy and nutritious foods. So you've got sort of that like financial strain. You've got like, how am I putting everything together, especially with rising rents? That's one thing. It's interesting in poverty measurement when so many things in our lives have actually come down in real cost. Like TVs are cheaper than they once were in real terms after we account for inflation. But housing is a lot more expensive than it used to be. And gas is more expensive, utilities, right? Utility costs. And so it's about the struggle of those things and, the strain of sometimes maybe, looking at a utility shutoff. And so you have the impact of having a utility shut off and what that means for families, but you also have like the presence of the risk of that. So it can affect families' health, right, through what kind of foods. And then when we think of like, chronic stress, we're thinking about just like those heightened senses of like, I have to worry about this, right? And our body does physiological things, which sometimes can lead to like premature aging.
Yeah.
So then, another piece that you had alluded to was like, what kind of risks does it open me up to? And so families who are low income, they often have to, you're trying to manage work. Most families, the great majority of families with kids have a working parent. So they're trying to manage school, right? But like, what does the kiddo do after school? Maybe I have an unstable work schedule. We're often like packaging together different forms of childcare, different forms of transportation. And when you mention things like ACEs, adverse childhood experiences, right? These are like the traumatic experiences that when they happen in childhood, we can see them reverberate throughout people's life course. And actually like ACEs, so this is physical abuse, this is sexual abuse, this is also just maltreatment, like verbal abuse, like all of these things we can actually see impact how healthy people are in adulthood. And they're way more common across the entire population than we like to believe, right? We don't like to talk about this stuff. But the thing about poverty is it just leaves people, especially children, more vulnerable to those things, right? Because you have to package additional things together where like, all right, my job, my schedule, I can get off at this time, so my kiddo is going to go stay with my uncle. And so it's really about like the positions that we put low-income families in that I think puts them at more risk of this, and the strain that sort of financial insecurity can really impact the well-being both of parents and kids.
Yeah, I like that. One follow-up question on this piece, and I'll kind of change tacks here to some of the policy considerations, but I think it's been a while now, but I remember reading a report because in the United States, we always have this sort of belief system of economic mobility, of if you work hard, you're going to get ahead. And I think what that report said back then was that more than likely, you're going to stay in whatever economic class you were born into, and it's more likely that you're going to fall into poverty than climb out of it. Is that holding true? What are you kind of seeing in the work that you do?
This is a really interesting question. So a couple of things that we know for sure is that Americans, as a rule, are more optimistic about their chances for mobility than the evidence suggests, right? So we do buy into that dream that you just described at a more, more than we should. There's also research that shows like the United States is less mobile than a lot of our peer countries. So, for a nation like that takes that creed very seriously, we're not particularly good at it relative to our peers. Probably the last interesting piece of this that our colleagues at Harvard, Raj Chetty and Nathaniel Hindren, their work really sheds light on is that there are huge differences based on where you live. And in the United States. So there are communities where, if you grow up poor, you are just as likely to rise to the middle class as anyone else. And then there are other communities where if you grow up poor, you're probably going to be poor as an adult. And so that provides some interesting fodder to sort of look and see what's different about those communities. And I have a new book called The Injustice of Place. And we do that for counties. And some of the interesting findings is the places where mobility from poverty is most likely are places where there's broad-based property ownership. You know, inequality is really, really low, and you know, health is pretty good. So I think you at least start to see some of the factors that go along with a story of mobility, which is, you know, to the degree that we like to think is true about us.
Yeah, I like that. And full disclosure, everyone, I had no idea that Luke had a new book on that exact topic of sort of like mobility. So when we're talking policy and everything else, just for everybody watching along, in Michigan, from our poverty task force, we're talking about 1.4 million Michiganders that are at or below that poverty, that low poverty line. 4.3 million Michiganders that are at or below the Alice line, which incorporates all those other things. And while it's probably only about 13% of Michiganders overall in poverty, 20% of it our children are. And so these are big, big numbers of people that are struggling with this. And you've been working on this for most of your career, I believe. What are some of the key pieces you think that we should be thinking about?
Yeah, well, I'll just mention one that's one of the primary things that I've worked on, and then I wanted to highlight a few things that are focused on jobs and employment that I think might be of particular interest. But you know, hands down for child poverty, one of the thing that we did that has been the most successful was expanding the child tax credit in 2021. So I, you know, got to work on the evolution and construction of that proposal over the years, and it was pie in the sky for a while. But President Biden made it a reality in the American Rescue Plan, and that program really starts from a logic that, like, raising kids is expensive, and people's lives are very economically volatile, just like I was describing to you. And the government has an interest in coming alongside families and helping the parents do the incredibly hard work of parenting. And it turns out many other countries do this all over the world. And what they do is they say, you know what, we're going to help families with a small amount of money, $250 per child, $300 per young child maybe, and families can be empowered to use that in any way that they think is, you know, the best for their families. And every country that implements something like this sees child poverty plummet 30–40%, and food hardship plummet. And here in the United States, that became a reality for really about 6 months at the end of 2021. And what did we see? Child poverty fell to a historic low, lowest we've ever seen by far. And like millions of kids lifted out of poverty. We saw food hardship, the number of families reporting they had trouble putting food on the table, fall to an all-time low. We, as I was telling you before, we actually saw the number of Americans with bad credit fall to the lowest level that we have recorded. That only goes back about 15 years, but pretty amazing, right? Families, we gave families a bit of money through the child tax credit and economic impact payments, and they used it to pay down their debt, and they were better off for it. So it was a resounding success. It did not become permanent because Democrats were short one vote, but I think it very much is something that continues to be of interest, and there's some interesting bipartisan support. So we'll see what happens in the future. A very popular one, of course, is raising the minimum wage. And the interesting thing about that policy is how popular it is with the American public. So, you know, you see time and time again, raising the minimum wage on the ballots for states and for municipalities pretty much always passes by like wide margin, 65%. And like, what do we as Americans, what else do we, 65% of us agree on anymore? So, the minimum wage is actually really good at reducing economic inequality, according to the Congressional Research Service. It's not as great for poverty because, you know, most of the people working for the minimum wage are actually above the poverty line. But many of them are in that Alice population, right? So you know, there's still a debate. There's still like concern that raising the minimum wage can have probably a pretty small impact on jobs, but there's a lot of really interesting research coming out about the other benefits of raising the minimum wage. There are studies that find Increasing the minimum wage leads to reduced smoking, leads to a reduction in the number of days where families are reporting they have like severe health limitations. And a really interesting paper that finds increasing birth weights among infants of low wage and low skilled workers. Another great paper came out that looked historically at the implementation of the minimum wage and showed that raising the minimum wage had this huge effect in reducing the black-white wage gap from like the 1970s onward. So, it's an interesting time for the research. You can see the impacts. It's popular. Families tend to do better. I'll just mention two more, Sean. One is a set of policies around work scheduling. So when we think about that instability in jobs, we're thinking about workers that are in retail, that are seeing their hours fluctuate, 31 week, 15 the next. The timing, like, is it during the day? Is it at night? And that's really hard for folks to deal with. So some employers have really stepped up on that. I think Walmart actually deserves a lot of credit for some years ago. They decided they were going to stabilize the work schedules of their workers, and I think they've really benefited from that. But then there are some states that have used legislation just to make it so that employers introduce more regularity, more stability into the work schedules of folks. And then a final really interesting model actually came out of Grand Rapids. This is the Employer Resource Networks, ERNs. And it usually has two parts. One, this is really a locally based approach. It's driven by employers. Usually it's groups of employers who are getting together to solve like common problems in the ecosystem. So maybe they get together and they all realize our workers are having huge trouble getting to our nighttime shifts or something. And so there are all these examples of those ERNs working with a city to change the bus routes so that people are more able to get to work, or make childcare more available at night, or whatever it is. I think it's an exciting thing, and they usually include a success coach. So that's somebody who works collectively for all of the employers, but is available to actually help workers like deal with challenges, right? How do I get to work? If I have this crisis, I can go to someone sort of outside of HR and get advice. And I think there's a lot of reason to think there's some positive impacts of programs like that.
Yeah, we've had some discussion and experience with the employer resource networks, and through our discussions on workplace mental health, we know a lot of employers have like employee assistance programs, which are based on health. We really talk a lot about tagging on this employer resource network, because a lot of times it's like my car doesn't run. I need like certain different things, and they're really cool. So I appreciate you bringing that up. And then because of your support and help, we did have one of your colleagues, Daniel Schneider from Harvard, on in February talking about work schedules in a report that they did for Michigan on the impact of the lack of a work schedule like that. So I really appreciate that. When you talk about the child tax credits, that was basically a concept you and I have discussed before. We had this whole like myriad of benefits, or at least the perception for most of us is that we have all these types of welfare benefits out there to help people get ahead or stay level, but they're difficult, right? And they're kind of hard to use, and they're pretty specific on what you can use them for. And the child tax credit was more of a direct cash assistance. Can you kind of just quickly cover why maybe those ones aren't hitting the mark and maybe that one was so successful?
Yeah, I mean, we have really important programs in our permanent, safety net, like food assistance, supplemental nutrition assistance program, or SNAP. That's a great program, but it can only be used for food. And so, people need food, but also people need toothbrushes or toilet paper. They need bus tokens, whatever it is. And so when you end up sort of restricting things, let's take housing as another example, right? We have programs that like help people with their rent. Some of the impacts is like it's not as flexible. Families actually know what they need the most, and sometimes they need food, but sometimes they need housing. But if you give them one or the other, sometimes you are sort of missing the mark. And the administrative costs are a lot higher. So, during COVID, we had a great example of this where those economic impact payments, they didn't go out, it wasn't perfect, but millions and millions of Americans got help very quickly after the onset of the economic crisis. In those same packets of legislation, we had things on like housing, helping people who were facing eviction. And those are important programs too. Michigan actually knocked it out of the park with those programs, but those took months and months to put in place. And a lot of the money actually went to paying nonprofits to help people verify income and to make the payments directly. So it's just sort of like a matter of like, how big do you want the government apparatus to be? Like, how much of the money that we use to help poor families should go to like all of the apparatus, and how much of it should go to families? So cash is the most efficient way to do it. Another piece of it is when you use an income test. So when you use an income test, you have to spend the time to find out, is somebody's income above or below that level? And I think one of the things we've learned about the Alice population is if you set that income test too low, or you say like you only get food assistance benefits, or you only get the child tax cash assistance if you're below the poverty line, there are a lot of people at twice the poverty line who are really struggling. And so you alienate them, right? You don't help people who really need it. And two, you alienate them because you say, I'm not going to help you, even though you're doing your best. I'm going to help this other person. And so programs that I think are a bigger tent, they say like the child tax credit said, we're not just going to help the very poorest kids. We're not just going to help the middle class kids. We're going to help all the kids, and we're going to do the same benefit. It can really be equalizing. It's simpler. The administrative costs are lower, and you can roll it out faster. So those are all the benefits of cash. The downside is like sometimes people, not a lot in the aggregate, but sometimes people are going to use money in ways that society might not intend. Interestingly, like we saw no evidence with the child tax credit of increase in opioids or substance use. So the overall evidence is that families are really good stewards of this money.
Yeah, I think too, drawing lines disincentivizes. I think when we think about like poverty and lifting out of
Right.
poverty, somebody's not going from poverty to, $100,000 a year. They're going to be around this line. And
Right.
when you kind of draw these lines, and I could pick up a few more hours, but it's going to put me just over this line, it really disincentivizes growth in employment, frankly. And the world, according to Sean, of course.
Us nerdy policy scholars call it marginal tax rates, where if you go to work, we're going to take away this, we're going to take away that. And when you have lots of different programs, if a family has food assistance, for every dollar they earn, they lose 30 cents on the dollar. They might lose 30 cents of their housing assistance, although not a lot of people have housing. And then if they got to find childcare, or they got to gas up the car to get there, you're really cutting into that paycheck. And so simpler programs that say, up through the middle class, everybody's going to get the same thing. With health insurance, that would be the same thing. So I'm really a believer in sort of simpler is better.
Well, I think with that, we got one question that came in at the end talking about how we effectively share this knowledge to try to shift mindset that exists with folks who tend to vote against themselves. More of a political question, but I think today is an example of that. So we got to have these conversations, we got to share the information, share the data. Anybody interested can go to the U of M Poverty Solution Center, research all over the place on there on a host of issues that you can use. And this webinar will be recorded and shared out again, or it has been recorded, and it'll be shared out again following today. And certainly open to continuing to have these discussions. And Luke, thank you so much for joining us today. Really appreciate your time, your experience in this area. So thanks again.
Yeah, it was my pleasure. And I just wanted to mention the stuff we did with the safety net during COVID, a lot of it was bipartisan, and I think we kind of missed the boat. Like, if I would love for people to contact their policymakers if they thought that was good policy. Contact it across both sides of the aisle, and I think sometimes we miss the successes we have because we're so focused on the challenges.
Yeah, for sure.
All right.
Well, thanks, Luke. Thanks, everybody.